Hi, Andy. How are you?
Hey, how you doing today?
Good, good. Guys, this is Andi Sparr. I'm going to introduce her to you all. And this is our second interview of the interview series for the Closer Look Project. Joining us today is Andrea Sparr, PAC. She's a dermatology physician assistant in the fields of dermatology and plastic surgery. Andrea began her career at Piedmont Plastic Surgery and Dermatology, where she spent 13 years as a certified surgical technologist, assisting both in and outside of the operating room, and playing a vital role in surgical care alongside board-certified plastic surgeons. Her time in the OR sharpened her attention to detail and deepened her commitment to patient outcomes, a foundation that continues to guide her clinical practice today. 2 years ago, Andrea transitioned into her current role as a dermatology PA at the same practice. She holds a master's in physician assistant studies from the Yale School of Medicine and is currently pursuing her doctorate of medical science, further underscoring her dedication to lifelong learning and leadership in the field. In addition to her clinical work, Andrea is the co-host of the Rejuvenesce podcast, a platform dedicated to accessible, science-based skincare education. Through the podcast, she brings real talk conversations and expert insights to listeners nationwide, bridging the gap between medical knowledge and everyday skin concerns. Whether she's treating patients, mentoring peers, or speaking to the next generation of PAs, Andrea brings passion, integrity, and a deep understanding of both the medical and aesthetic side of dermatology. Please join me in welcoming Andrea Sparr.
Thank you.
Andrea, that's a very impressive bio.
I worked hard on it. It took me 36
Yeah,
years to get there.
yeah. Yale School of Medicine. That's amazing.
Yes.
I didn't know they had a PA program.
Yeah, they have an on-campus and then they had a hybrid online PA program. I was a part of
Okay.
it, and their last
Really?
graduating class for that will be this coming year.
Wow. So how was that?
It was fabulous, but the guy that started our program, Jim, he was fabulous. His name is James Van Ree, and he thought about doing an online program. He pushed for it. He did it, and here we are. I was the fourth graduating class.
That's very cool. All right, so we are going to talk about your experience, your perspective on skin health and care, skin cancer detection, all the things that involve the Closer Look Project. If you don't care, start by telling us a bit about yourself.
Put my heart and soul into this field. And when I started at this company so long ago in 2010, I never thought I would be here today. It's a great company to kind of grow up in because when I started here, I had just turned 21. So I
Wow.
have went through many life changes with these people that I work with. They have mentored me and got me to where I am today, and they're the reason that I love skin so much.
Yeah. What a cool thing to start out as a surgical technologist. And I shared with you before that I was also a surgical tech. I didn't know that you were until just today. But that's where I started too. I did plastic surgery, general surgery, and then we did urology as well and eyes. And I loved it. But it made me realize that I wanted to do something else,
Yeah.
something more hands-on with patient care. So, but it's so cool for myself and you as well to start out as a surgical technologist,
Hmm.
and so for you to climb the ranks and become a PA, and now you're treating patients, and you're so much of an advocate in your field. That's amazing.
Thank
So I commend you for that. So what does a typical day look like for you in the dermatology practice, and what aspect of it is the most interesting to you?
So I work 4.5 days a week. A majority of my patients are skin checks and skin cancers and excisions. I still see
Hmm.
rashes, alopecia, all the acne. I mean, it's you got to be well rounded when you work in dermatology, right?
Yes, I mean it's the most important. I was thinking about that today, actually. With our jobs, dermatology is hard, but cancer, it's not easy, but it's routine, right? Like,
Right.
there are so many types of acne, so many types of alopecia, so many types of, psoriasis and all these things. But cancer, it's the most important part of our job. It's the most important thing that we cannot miss, right? We can
Right.
misdiagnose acne as bacterial acne versus fungal acne, but you can't really misdiagnose cancer. It's
Right.
too important. It's good that that's something that we see a lot, but it's also unfortunate for those patients. What is the most rewarding aspect of your job as a PA in dermatology?
I think when you go into dermatology, especially versus like other specialties like primary care, you don't get to see physical change when you see blood pressure and diabetes calm down, but you see physical change with skin cancers being removed, acne being fixed, rashes going away. So I think
Mm-hmm.
there's that full on benefit of getting to see up and close and personal the change that you physically made versus on
Yes.
paper that most other specialties do.
Yeah. How often do you see like your Accutane patients coming back? Their head isn't hanging down anymore. You can't touch them,
My
right?
favorite thing is on day one when I meet them, I said, we're gonna get to a point that I'm gonna say, when is the last time you had a bad breakout? I said, and you're gonna say, I can't remember. And when we
Yep.
get to that point and they say that, they're like, oh my God, you said that on the first day.
Oh,
So,
it's such a good feeling, right? It's so rewarding. It's so rewarding. I'm getting like little chills just thinking about it, no matter how cringy that sounds. But yeah, I think that's a good aspect of it. So, in your experience, what are the most common skin conditions that you treat and diagnose on a regular basis?
anywhere from basal cell, squamous cell, little pre-cancers. Of
Mm-hmm.
course, you explain 1,000 times a day what a seborrheic keratosis is because that's the thing
Yep.
that people
Yep.
are most concerned about.
They're the ugliest.
Yeah. And then melanoma. Like I called somebody today and I had to tell her half her biopsies came back as early melanoma. It's like melanoma
Mm-hmm.
is, I don't wish this
Right.
upon anybody, but it's something you don't want to miss as a provider.
Absolutely. Is that a hard conversation for you to share with patients?
Not really, because a lot of times, like I said, I prepare them the day of the biopsy. I'm like, this is funky. And I explain the spectrum of moles. I don't know if you kind of go through that. I'm like,
I
on this
do. I
end, you
do.
got the benign stuff. On
Yep.
this end's melanoma, and you have the whole
Mm-hmm.
spectrum in between. So I
Yeah.
fully explain to them when I'm doing the biopsy, this is funky. This is what I see with yours. Sometimes I even have my staff take a picture with the camera on my dermatoscope so I can show them
It's
the
nice.
colors
Mm-hmm.
and chaos that
Yep.
we look for when we see these things. And I say, if it's melanoma, you'll hear from me. I'll be the one calling you. I don't have anybody
Good.
else call my melanomas. But if it doesn't look like that and it does look like an abnormal mole, I say, I don't think it looks like melanoma. Don't lose sleep over this. It's nothing we can't take care of. But again, there's
Right.
always that 0.1% that you were like, that looked like a mild dysplastic, and it comes back
Y-
as melanoma inside you.
yeah. Or
So
invasive.
again,
Mm-hmm.
I tell everybody I can't see through the skin. I can't see the physical cells. I can just see the change that makes me need to biopsy that.
Right. Absolutely. I had a patient once, 70 years old, who had the darkest SK that I'd ever seen in my life. Seborrheic keratosis, for the guys that don't know what SK is. And I biopsied it because my gut was like, this isn't normal.
Right.
And it was invasive melanoma. So I mean, it just goes to show that even your bread and butter, it's not always just that. So regarding skin cancer, what type do you most frequently diagnose in practice? I know we just talked a little bit about that,
It's
but
probably split between basal and squamous cell. It
yeah,
really is.
yeah. And then in terms of like your age demographic for those, would you say, most are over the age of 50, or
I'd
is it kind
say
of
45 and up.
okay?
When you talk
Mm-hmm.
to people, you're like, your body is going to take 20 to 30 years for even to present some of these skin cancers
Yeah.
because it's not what you did last week. It's what you did in your teens and your 20s finally catching up to you. But as shockingly, I was saying on our podcast, I'm seeing more 30 years and younger popping up with melanoma just from living in the tanning bed every single day because they had
Absolutely.
that much exposure in that small period of time.
Yeah. Yeah, that's a hard thing for people to wrap their mind around, that it can take, 30, 40 years for an actinic keratosis to become squamous cell, right? So, yeah, and that's always the argument or like the conversation is like, well, I've tanned for 10 years. Okay. And
Why
you'll
do I
see
have nothing
that.
now? Yeah, but it's going
Right,
to
but you'll
catch, and
see
I say
that.
it's going to catch up to you at some point. And
Yep.
when it does,
Yep.
that's when you start needing to be getting in every 6 months, every year,
Yeah,
because things
absolutely.
are going to keep popping up.
Yep, so true. So, could you describe the typical presentation for those cancers that you see, and kind of how you educate your patients in terms of what to look for when they should be concerned?
Well, I always tell them, if something's been there longer than 6 weeks, because again, as you age, things heal slowly. Okay. I
Hmm.
give anything the benefit of the doubt. If it is a bug
Yeah.
bite, it could take 6 weeks to heal. But at that point, I'm like, if it's still hanging out, it may not be a bug bite. You need to call me because I'd rather take a look at it. Because I'm the type of person that if it's early and we catch it early and I can freeze it, I'd rather do that than have to cut on you.
Yes.
You
Yeah,
know,
for sure.
they fully appreciate that. So my people, they'll call and say, I got the spot. She told me to call. Get in here. And it's probably an SK, but I'd rather them come
Right.
in and be safe than sorry.
Yeah. And if they do
But
it enough, then they may know what an SK is, right?
but you're looking for like ulcerations in the skin, bleeding areas. For my men, especially on the face, a lot of times they'll feel a basal cell coming on before they even physically see it. So I'm like, you
Hmm.
got a stinging, burning sensation and anywhere on the skin that when you're running your razor over, or you got one little patch that just keeps bleeding. Again, squamous cell can be a little hypertrophic. It can actually look warty like in some appearances. So people that are like, oh, I just got a wart on my face, and I tell them it's still got to go to the lab because squamous cell
Right.
can present as a wart. Cutaneous horns can look like that.
Yeah.
So Not everything presents textbook like a pearly pink papule like basal cell. Basal cell can be an ulcerated lesion that's bleeding on you. But if you look at
Yeah.
it with our dermatoscope, you're looking for the little branching blood vessels that are in it. The way the edges of the skin starts changing because it's starting to eat down into the skin. So I just explained those patients. Again, the 6 weeks is my cutoff because, like I said, I will give anything the benefit of the doubt, and I'm
Hmm.
not going to cut on you just to cut on you. But I don't want
Right.
something sitting there festering for a whole year for you to come back to your next skin check appointment.
Yeah, and a lot of people do because they
Yeah,
don't know, right? So you talked about people thinking, oh, it's just a wart.
right.
So, yesterday I talked with Dr. Law about, perineural involvement. So, like, if it is starting to tingle or be painful or to
Mm-hmm.
touch, warts aren't, I mean, they can be painful, right? But they're not typically painful. So, if you have someone that says, oh, this mole is painful or
Yep.
this bump is painful, is that usually a sign for you too that it needs
It
to be checked
is,
out?
and again, I tell them, best case scenario, it could just be an irritated area that
Hmm.
you've been hitting when you're grooming. Your clothes are hitting it when you're taking
Right.
off. It's on your hand. You hit it every time you touch a door handle.
Hmm.
That could be irritated, but it also could be a sign of something. And I always
Yeah.
say, if something's funky, it should always come off.
Yeah. So, talking about skin cancer now, how to prevent it. So, what do you say to your patients in terms of educating about SPF or UPF?
So I'm a big fan of mineral and zinc sunscreens, and
Hmm.
the older people are like, "Oh my God, I don't want that white stuff on my nose," because they
Yeah.
all think about the old
The white
school
cast.
lifeguards that
Uh
had the white
huh.
on their nose, and I was like,
Hmm.
they make better zinc nowadays. So
Yes.
even my older women that still wear the thick, thick, thick makeup, I'm like, honey, they make tinted sunscreens now. You will love that. But mineral zinc are my go-tos. I love brands
Hmm.
like La Roche-Posay,
Me too.
Cetaphil CeraVe, even those that have them in their moisturizers. I highly recommend 30 plus SPF. And then I always tell my ladies, if it's in your makeup, it's going to take a whole tablespoon of that makeup to equate the amount of sunscreen that's in it. So that's not good enough. You're still
Yeah.
going to have to put another sunscreen on. And they're like, oh my goodness. So then I pull out, I'd rather use a tinted sunscreen as your base foundation versus a makeup that has a 15 SPF in it, because you're not even
Right.
getting the 15 SPF.
Yeah, that's a good point, and people don't think about that. And there's like the trend on TikTok right now where people are doing like the length of their fingers or whatever.
Yep, so it's 2 fingers lengths. And
Fingers
we
length.
have
Yeah.
little cards at our job that we give out that has a hand, and it has everything labeled of how much a pea size is of this, 2 lengths of sunscreen and stuff like that. And I can send
Yeah.
you a
I
picture of
like
it. It's
that. Yeah,
really
please.
nice.
I'll share that with everybody. Yeah, because that's not even something that I came across in my practice. I never
Right.
knew the two finger thing. I never knew that. But it's good that people are becoming aware of those things. I think it kind of shocked a lot of people.
And I think a lot of older people are more visual too, because you can talk all
Absolutely.
day and you can say all these big words, but without them seeing what they actually have to do, it's hard to understand how much is a pea size, how much is a half
Right.
gram. So just giving them that gives them a little more comfort too, because I say put it beside the sink in the bathroom on the mirror,
Yeah.
or hang it on the fridge. That way you'll always remember you got to go back and put your sunscreen on.
Yeah. Those are good little things for your older patients for sure. Okay, and so have you ever had a patient come to you and say, my hairdresser, my manicurist, my massage therapist, any personal care personnel, have you ever had a patient come to you and say, they told me this needs to be checked
Yeah.
out?
And I love that, because
Yeah.
even when I do skin checks, I go in a certain, I don't know about you, but I go in the same um,
Very systematic.
systematic way every
Mm-hmm.
time. Start with the back, worm it down, and I do the face and scalp blast. Because while I'm up there talking, I say, "Do you see a hairdresser? Have they ever told you they were worried about anything?" And they're like, "No," or they'll say, "Oh yeah, she said I got this pink mole back here on this side." Because hairdressers, I don't know where you are, but here a lot of them at least do a small course of, there's lesions in the head. If it
Mm-hmm.
looks funky, you need to let the patient know so they can actually get it looked at, because they're not
Right.
diagnosing. They're just trained to keep an eye on something that could potentially be a problem.
Mm-hmm. Yeah, and I think a lot of cosmetologists, especially, yes, they're taught that, right, but it's not reinforced into their daily practice, or it's not reinforced in terms of the specificity of certain lesions or whatever. So then it may just become routine and they may forget about it. So I
Right.
think being intentional about those things or having resources can be really helpful too. But have you actually had someone send you something that was like melanoma or basal or
So
squamous?
yeah, I had somebody send me some that was like an ulcerated basil that was already the size of a quarter by the time it got
Yeah.
to me. So I'm like, I know this thing's been festering a while, and they just hadn't been in here, and they probably
Yep.
been told the last 3 haircuts that there's a problem.
Right.
But
Yeah.
yes,
Good. Yeah. And I have too. That's kind of what started, the Closer Look project, because I was seeing such a huge pattern with that.
right. And your
Um,
grandpa had melanoma, right?
yeah. Yeah. He has stage 4 right now. So, and he just changed treatments today. He just had an infusion, but yeah, that's a big base of the story. Is like my
Huh?
papa doesn't go to doctors, but he gets a haircut every 6 weeks, or even more frequently than that. So yeah, I mean, I think they're so important. Not just hairdressers, like I said, manicurists and tattoo
Yeah.
artists and
I've
massage
actually,
therapists.
and I've had a patient come in. He said my masseuse noticed something on my back
Hmm.
because those
Yeah,
patients still go get a massage every 4 to 8 weeks. So
right, exactly.
definitely have pushed them into the office at least to get
Yeah,
something checked.
yep. Just nudging them along is enough, right? So it seems like you have a pretty good mindset about hairdressers or whoever being a key player in that early detection. Did you ever have like a strange notion about it, or like, oh, they didn't practice, they're not a provider, so they can't do that?
No,
Do you have you ever
no.
had that
And
feeling?
I've never had that, and I've never felt that way. And I guess some people may, but it's
Hmm.
definitely not going to be me. I appreciate help from anybody that's out there because there's always that question of if I see a mole on somebody that's dark, and should I go up and say you probably should get that looked at? And
Right, right.
there's a fine line for some people where like I'm not doing that. I've done that at a
Hmm.
freaking amusement park, and I was like, none of my business. But if you've never had that looked at, have that looked at. And she's like, oh, yeah, my dermatologist is watching it. It's one of the
Yeah,
funky ones I got. And I'm like, okay, I'm just making
yeah.
sure because I never want to, if I see something, especially when it's dark, because again, not all melanoma is dark. A melanotic
Hmm.
melanoma can look like basal cell and you'll be
Yeah.
shocked when it comes back. But dark like that, I definitely want to speak up because you never want to be like regretting something, especially if you
Hmm.
see an obituary and you're like, that's that
Yeah.
person I saw 5 weeks ago. That I never want that on my conscience. So I
No.
appreciate the
Yeah.
help from all the outside people. Again,
Yeah.
it may be nothing, but you rather it be nothing than something.
I love that perspective. But not a lot of healthcare people share that, providers especially. So I'm glad to see that that you do. There was a time that whenever I first started that I would have someone come in and like their mom, their dad, or whatever would be like, oh, look at this spot or look at this spot, and I would get a little bit irritated. I'm like, okay, I'm looking, I know what I'm doing, but in reality, they know what's different, they know what's changing on their
Yeah,
on their
because they see
families and
them more than we
themselves.
do.
Right. And so it took me a couple times and a couple, of those situations where I'm like, yeah, I believe you. Show me. Yeah, that's a good perspective. So how do you feel that a program like the Closer Look Project can be helpful to educate those non-healthcare professionals?
I still think for the people that are a little naive to what like scalp lesions actually look like, especially when they're flatter and they blend in a little
Hmm.
bit better, that's going to be an amazing educational component for them just to be able to pick out those lesions because
Right.
you can always see something raised. You can feel something raised, especially if they're rubbing your head or washing your hair or cutting your hair. But sometimes it's the flat ones like those halo nevuses that you see in kids and stuff, they can be hard if they have darker hair to actually
Right.
see. So if they know a little bit more about what potentially could be in the scalp, I think we will start seeing a lot more patients coming in.
I totally agree. And eyes everywhere is never a bad idea,
No.
right?
And
If you
like I
have
tell everybody, you don't know what you don't know. There's no stupid question because you just don't know.
No, I totally agree. Yeah, I think that'll be a good, component of this too. I think it's really going to help a lot of people. What role do you see community education playing in overall skin cancer outcomes? Like in terms of programs like this,
Right.
or just awareness for SPF and like making sunscreen
I would hope in the next
accessible.
20 to 30 years that we would start seeing a decrease. Because, again, remember, it's going to take 20 to 30 years for things to appear, and it's
Yes.
going to take change now to see it in the future. I would hope that things do start to decrease. I hope more people would be actually willing to go see a dermatologist and not scared that they're just going to go get whacked on and botched.
Right.
Because some people just are so scared of scarring versus a
Mm-hmm.
mole being melanoma and they don't understand.
Yeah.
But my hopes would be in the future that it would actually decrease the rates of need and definite need for so many skin cancer excisions and Mohs
Yeah.
surgeries and radiation and all that.
So in terms, that's not really on the question list, but in terms of radiation, like in the
Right.
office that I worked in, we had SRT.
Yes, we have SRT
Um,
too.
and that's amazing. I mean, our patients were loving that. But I think that will also increase people's feelings toward treating their skin cancers and not being so scared to go to the derm office as well.
People make if it's a lip, if it's a nose, if it's an ear, those tender places that do not have a lot of skin, that Mohs surgery may just be not in question. Those are good
Hmm.
places for SRT if they have the
Yeah,
time to put into it because it's 3 treatments
it's
a
a
week
lot.
for 6 to 7
Yeah,
weeks, but they're only there for 20 minutes. The other
right.
thing I have to be mindful of is some patients still have regular insurance and their copay is still $100, and if they they have to pay
Mm-hmm.
$100 3 times a week. Sometimes that's not feasible. So it's
Yeah.
all about explaining everything to the patient up front, because in the long run, they're driving the bus. You're just giving the recommendations.
Yep.
But for everybody that I have sent for SRT, they fully have appreciated it because it has
Hmm.
saved them a scar.
Yeah. It's amazing. Okay. And so we already talked about how you approach sensitive topics with patients. We already kind of touched on that with the melanoma conversation. What do you think is the most challenging aspect of your job as a PA in dermatology?
I think a lot of people still don't know that PAs and NPs are mid-level providers and that we
Yeah.
actually can treat and diagnose. And so
Hmm.
sometimes they come in very wary and hesitant that they're not seeing an MD or a DO, and it takes a little bit to gain that trust from that patient.
Yeah.
And eventually we get there. Eventually we get there because I explain, I've been doing this a while. I treat skin cancers. I do my own excisions. I was trained by some of the best MDs that I work with currently.
Yeah.
I came in on my off days when I was in clinic from school, and I trained even when I didn't need to, because you don't know what you don't know. And I
Yeah.
always tell people you should never stop learning in life. There's always going to be something that you'll know. Like I said, a melanotic melanoma, the first one I ever diagnosed of that, I thought it was a basal cell.
Yeah.
It looked like a basal cell. So again,
100%.
always learning, always changing, explaining that to patients, explaining that up front, that I did do clinical rotations. I went to school. I have a master's, and explaining that I'm actually working on my doctorate right now too.
Yeah.
It puts them at ease that know that we actually put so much effort into becoming a mid-level provider,
Yeah.
and that we're able to take care of them too.
Yeah. I think that's a pretty common
It is.
challenge. It was for me too. I have quite a few people that had said stuff like that to me, but by the time that they had been with me for 6 months or a year,
Yeah.
they loved me. And I actually had one when I left my last job. She cried. I just thought
And
that was so sweet.
I've had some that they're like, this is the most thorough exam I have ever
Yeah.
had. The last MD that I saw spent 5 minutes with me.
Yep. And no shade to
No,
physicians,
no,
right? But like, it's just a different approach, and it
it's
doesn't mean that we're more thorough or that they're more thorough or
no.
anything
And
else.
everybody's different, and everybody
Mhm.
approaches skin cancer differently. And just because they
Right.
approach it differently in a different aspect does not mean they're wrong. But
Right.
I tell them, I just like to slow down, because if you have that many moles, I do not want to miss something.
Yeah, I agree. I totally agree with that. How do you stay current in like the latest advancements with medicine and research and all that data?
So I basically live on up to date. They have all
Hmm.
my money every year when I have to
Yeah.
renew, because that's the most
Uh-huh.
expensive thing that I have that is a resource. I also hit AAPA, SDPA every year. SDPA is for the dermatology
Hmm.
PAs. They allow MPs to come now, which is
I'm an
great. So,
affiliate.
yep.
Yeah.
So again, it's just those extra resources to kind of keep up to date on new and improved techniques, new and improved
Right.
medications, new ways to look for skin cancer. They even have
Yeah.
little attachments for like a phone now that will actually
I
analyze
saw
the
that.
picture and tell you if they thinks it may need to be biopsy or not.
Yeah, they're the one that I'm familiar with is called Sclip.
Yep, that's the one. I got
Skin
two of
clips.
them a
Yeah.
couple of years ago.
That's such a cool tool, and it'll be really good for people who are in that non-healthcare field like hairdressers to be able to take a photo and let a dermatology provider check it out,
Yeah.
right? So yeah, I think that's a cool invention there. What is a common misconception about dermatology or skin health that you have?
That it's only for people that are non-skin of color.
Yes, so true.
So I think it's explained to a lot of people, even when you have highly pigmented skin and you have the darkest skin out there, that's really only an SPF of between like 13 and 20. There's
Right.
no protection. And I think people with darker skin tones feel like because they're darker, they're protected from the sun and that they'll never get a skin cancer. But not all
Yeah.
skin cancers from the sun. I have to go through and explain that a lot of it can be genetics. So
Yeah. Yeah.
even bringing people in and saying, acral nevuses are legit on people with skin of color, Hispanic,
Yep.
Latino population. So those are the
Everyone
things you
knows
got to
about
keep an
Bob
eye on. Yep.
Marley.
Bob Marley, I
Hmm.
explain that's why I look at their feet, because
Exactly.
they're like, why are you taking my socks off? And I'm like, Bob Marley had melanoma between his toes. I do not
Uh-huh.
trust anything, because a lot of people don't get down there.
I
And
know.
I feel like, when we're talking about outside healthcare professionals, I feel like a lot of pedicurists or people that work at nail salons, they're not checking. They're definitely not checking
No.
because they're in a hurry. So the only people that are getting that close to your feet is going to be me or them. So I
Yep.
always check as much as I can, and I take pictures. And because I explained those
Me
can
too.
change fast. It's a different type
Hmm.
of skin. If it's dark and it's on there and it's funky, it's coming off now.
Yep, I agree. I think why manicurists and nail techs would benefit from something like this too,
Yeah,
because when I have women come in, it's seldom that they have taken their polish off,
yes,
right? Like I don't know if you feel the same way, but they hardly ever take their polish off before the skin exam.
no,
So someone needs to lay eyes on them. I would prefer it to be me, but someone needs to if you're not going to let me do it,
right.
you know. And dark spots on the nails. It's not rocket science, right? You see a dark spot, let us know. That's pretty much, that's my opinion anyway. Beyond clinical diagnosis and treatment, what other resources do you often recommend to your patients?
So I recommend Visual DX because again, you can still
Hmm.
get like a guest one of those, like the basic version. And you don't have to
Hmm.
pay for it because you can always look up your age and it'll show you what
Yep.
some cancers and lesions can look like. The main thing is stay away from Dr. Google because everything on Google is going to be psoriasis or melanoma.
Right.
Because everybody
Exactly.
comes in, they're like, I have psoriasis or I have melanoma. I'm like, that is far from it, baby. Um,
Right.
but those resources, asking your primary care, at least if you have a question, if you need a referral so they can get you a
Hmm.
referral. Some primary cares around here will actually do the biopsy before they
Wow.
send them out. So I already have a diagnosis of those specific areas. They'll still get a
Treat them.
skin check by the time they get to me, but they can at least get set up. So,
Yeah.
and I think that helps push them even further into coming in to see me if they already got a diagnosis of they have cancer from another
Right.
doctor.
Right. And it takes so long to get into a dermatologist
Yes.
office, right? So
And I'm
so it's so
actually
helpful.
writing my paper for my case study for one of my doctorate classes on the length of time it takes to get in to see a dermatologist, especially in rural areas.
Yeah, that's an amazing approach. Please send it to me whenever you get it, because it's so true.
Yeah.
It can take 3 to 6 months,
Yes.
or longer,
Hmm.
depending on the area, like you said. So yeah, and I spoke to someone recently, and they were talking about educating your referral network. So if a primary care sends you something like an SK, educate them. That way, we're not taking up space on that appointment list, and they know what an SK is, right? I mean, always send it if you're unsure,
And I feel
but
like that is becoming more prevalent because at the one of the
mhm,
last conferences that I did, it was a derm. It was an APA a couple years ago.
mhm.
She spoke directly to the primary care providers about things that you would see skin wise in a primary care office. And then the very last slide was, please stop writing betamethasone clometrazole. And I thought
How
that was the
often is that
funniest thing every day,
compounded
every day,
every day?
every day, because
Every
that's their
day.
go-to.
All of
They're
my
like, I don't
peoples.
know, here you go. But
Uh-huh.
she really explained like what a SK was, what they were
Hmm.
looking for. So because some of these patients are so scared by the time they get to you because somebody was like, oh my God, that looks terrible. And then even your
Right.
primary care provider has probably told them that because they
Hmm.
didn't know what it was.
Yeah.
So
Skin is hard.
skin's hard. And like I
Hmm.
said, but we don't have to terrify these patients because it's going to take them forever to get in. They've got to think about
Yeah.
that for 6 months. They're living on Google. They think they're dying
Hmm.
already. So it's a lot when you have to get somebody in there to calm them down before you even touch them.
And it's often, right? It's
Yes.
often that you have to do that. That's a good point. Looking ahead, how do you envision the Closer Look project contributing to a healthier community? So, what would you want to see from a project like this?
I would like to see local places like hairdressers and stuff have business cards of ours on hand
Hmm.
so they can hand them out if they see somebody. Because the last thing you want, especially for an elderly patient, is trying to track down a provider or
Right.
even know who to start with to be seen. So even just having
Yeah.
a list on the wall of these are the local dermatologists, these are the local hospital dermatologists if you're associated with this specific network, just something
Yeah.
like that that will put them in the right direction to get them to where they
Yeah.
need to be.
That's so smart. And that's something that I should definitely work on because not everybody's going to say, "Oh yeah, your hairdresser says there's a spot. I'll take you right now," or in 2 weeks or whatever. So that's a very good point. If you had to guess on how many times on average per week would you say that a hairdresser would notice a lesion and think it's cancer and encourages the patient to see you? I mean, would you say once a week, once a month,
I
once a
would
year?
say probably once a week. I see about 150 to 200 patients a week. So in the
Wow.
midst of
Yeah.
that, I would probably say at least once a week, if not more
Which is
times a week.
crazy. That's
Yeah.
so. I mean, that's crazy. People don't realize that.
Yeah.
But yeah, I definitely do too. Okay. So this is a study that I found, and it kind of did a retrospective assessment of a cancer facility. And between 2008 and 2014, they found that 10% of their head and neck melanomas were referred to them by a hairdresser.
Yeah.
Is that shocking to you? Do you feel like that's absolutely believable? I'd say you probably do since what we just talked about.
No,
But
I don't think it's shocking at all. Like I said, and like you said, more people go get their hair done than they show up for their doctor's visits.
yeah,
So
for
they're
sure.
getting pushed from those directions from those providers.
Yeah, I agree. So, do you have any words of wisdom to anyone that could be watching this interview? Do you have anything you want to share?
You don't know what you don't know. That's my favorite thing. You are not
Yeah.
stupid. No question is stupid. If you don't know what you're looking for, always get checked. Even
Hmm.
if you've never had a skin check and you're only 25, go ahead and get one because if you've ever had a sunburn, you have a potential chance of getting skin
Yeah.
cancer. So even getting in yearly, every other year at this point, you can catch things a lot sooner. It'll save you a lot of heartbreak and heartache in the long run,
Yeah.
especially if you have to go through multiple Mohs because there's people, like I said, now that were in the military and all this stuff, and they're coming, and their arms are just scar.
Right.
All the UV exposure because they didn't give you SPF when you were out there
Tons.
fighting, you know.
Nope.
So, but yeah, you don't know what you don't know. No questions are stupid. Go see a dermatologist. We're 99.9% of us are nice. I can't speak for everyone, but a lot of us care. A lot of us,
Yeah.
this is our livelihood. We love doing this job. And people were like, I'm so sorry you have to look at my hairy legs. Honey, I chose this life. I chose this
Right.
life. I'm good with this. Do not worry
I'm
about
pulling your socks off. Let me see them
me.
crusty feet.
Yes. I do not worry about me, baby. My legs are hairy too.
I love that. Yeah, I think just creating that, that human complex about like we're the same as you. We just know about skin. So, yeah, thank you so much for
Yeah.
joining me.
You're welcome.
And I
Thanks
hope
for
that we
having
can,
me.
you're so welcome. I hope we can do something more together soon.
Yeah.